Canada. Across the country, in every province, every territory, every region, more and more Canadians are trying to navigate the healthcare system without a family doctor. It does not feel good. It does not feel stable. And it certainly does not feel like the system is built for the reality we live in today. Appointments are hard to get. Clinics are crowded. Urgent care centers are stretched. Virtual care is inconsistent. And even when you finally sit down with a provider, the appointment can feel rushed or incomplete. If you felt that, you're not imagining it. And you're not alone. This video is here to give you back clarity, control, and confidence, even in a system that is struggling to keep pace. Not hype. Not fear. Just calm, steady, practical guidance so you can navigate clinics, pharmacists, urgent care, and virtual care with a system that works for you. Because in today's Canada, preparation is not optional, it's how you stay steady. Canada's population has grown faster than our primary care capacity. Family doctors are retiring faster than they are being replaced. New graduates often choose different practice models. Clinic funding models vary between provinces and territories. And demand has increased, especially among children, older adults, and people managing chronic conditions. The result isn't a mystery. Longer waits. Shorter appointments. Fewer available physicians. Higher demand on walk-ins and urgent care centers. Increased reliance on pharmacists. Virtual care expanding, but uneven. And continuity becoming harder to maintain. This isn't a failure of Canadians. It's a mismatch between capacity and reality. Understanding this isn't discouraging, it's empowering. It tells you where your leverage is. Most Canadian clinics operate under time-pressured appointment models, typically 8 to 12 minutes. That is not enough time to explore multiple problems, track chronic issues deeply. You review medications carefully, plan follow-ups, or catch subtle red flags. It's not because providers don't care. It's because the structure they work inside is narrow, outdated, and rigid. The gap between what patients need and what appointments allow is one of the biggest reasons Canadians leave feeling uncertain. This is why the clinic playbook matters, because clarity and preparation can compensate for structural limitations. Canada's primary care model was built for a time when populations were smaller, regions were less complex, chronic conditions were less common, digital tools didn't exist, pharmacists had narrower scopes, virtual care wasn't an option. Appointment lengths didn't need to handle today's realities. But the world changed. People live longer. Demand is higher. Technology is faster. Pharmacists can treat more. Virtual care is now essential. And families rely on systems that simply haven't caught up. Modernization, the version Canadians deserve, looks like coordinated clinics and pharmacies, clear continuity systems even without a family doctor, digital access that works across provinces, flexible appointment lengths for complex issues, more nurses and pharmacists integrated into primary care, stable referral pathways, predictable timelines. You cannot control the modernization pace, but you can control how you move within the system today. That's where this playbook comes in. Walk-in clinics. Go here for infections, respiratory symptoms, persistent cough, sinus issues, mild injuries, simple renewals, lab orders, and early assessments. System reality. Walk-ins are overloaded because they're filling the gap left by family doctor shortages. Urgent care centers. Go here for issues needing imaging, monitoring, or on-site treatment, serious, but not emergencies. System reality, urgent care is the safety valve when the front door of primary care is blocked. Virtual care. Use virtual care for renewals with verification, non-urgent questions, lab review, mental health conversations, allergy flare-ups, follow-ups, and triage. System reality, virtual care fills gaps, but cannot replace in-person assessment when symptoms escalate. One clear sentence explaining why you're there. Write a single, focused sentence that tells the provider exactly what today's visit is about. A simple timeline of the problem. Include the start date, how the symptoms have changed, what triggers them, and anything you've already tried. Your full medication list. Write down dosages, how often you take each medication, why you take it, and any recent changes, including supplements or over-the-counter items. Your health card. It is essential for access, registration, and proper documentation. 2 questions you must ask before leaving. What should I watch for over the next few days? If this does not improve, what is my next step? These 2 questions close the communication gap created by short appointment times. Pharmacists can manage allergies, eye irritation, eczema, simple infections, prescription renewals, smoking cessation support, blood pressure checks, medication interaction reviews, vaccines, travel medicine, symptom triage, and escalation. They are often the fastest way to get clear guidance when symptoms are mild, early, or uncertain, especially when clinics are backed up. System reality. Pharmacists are becoming the new first stop for everyday Canadian health concerns. Use urgent care when symptoms are persistent, escalating, unclear, or have not improved after walk-in or virtual care, or involve any of the following. Breathing difficulty, chest pain, severe abdominal pain, injury needing imaging, dehydration, significant fever, sudden weakness, sudden vision changes, sudden difficulty in speaking or any new confusion in thinking, a severe headache that feels different from usual. Urgent care prevents delays from becoming emergencies. Continuity of care is created by you, not the system. Return to the same clinic whenever possible. Keep copies of your lab and imaging results. Maintain your medication list. Prepare simple symptom timelines. Use virtual care for follow-ups. Track any changes. Document previous visits. This is about control over your health, taking charge of it, not placing blame. You are allowed to be prepared. You are allowed to ask questions. You are allowed to advocate for yourself. These are not demands, they are your rights inside the healthcare system. Preparation is empowerment. And empowerment is control. Modernization takes time. And while systems change slowly, Canadians do not have to wait to build clarity and control in their own healthcare. One visit at a time. One prepared appointment at a time. You move through a complex system with steadiness instead of chaos. These small steps matter. They create stability for you today, and they set expectations for a healthcare system that must work better for the next generation. Preparation is not just personal control. It's stewardship, and it shapes the Canada we hand forward. Like, subscribe, share. Because knowledge is empowering. And being empowered is being prepared. Canada only. Start Here playlist is on the channel.